Well, good afternoon, everyone, and welcome. Aloha. I'm Ron Mizutani, President and CEO of PBS Hawaiʻi, and we thank you for joining us. These short films today, Independent Lens, Bridge Builders Collective, something different we tried today, and giving you these short films. They're all available on YouTube at Independent Lens throughout our discussion today. You're going to see a QR code on your screen. Please consider providing a gift to PBS Hawaiʻi. Without support like you, we can't do these types of virtual screenings and programs and have panelists like we do today. Joining us this afternoon for a Q&A is Ann Komatsu. Ann is the Executive Director of Aloha Diaper Bank. Ann, thank you for joining us. And Nikki-Ann, co-founder of the Maʻi movement. Nikki-Ann, thank you for joining us as well. And for those who are submitting questions, please, we'll get to as many as possible. We encourage you to do so, and we're going to get to as many as we can. I got one right away. So I'm going to jump right into it. Nico's asking, the Aloha Diaper Bank and the Maʻi movement are two clear examples of mutual aid in action. What other groups out there right now doing good work, whether urgent human needs require sustained direct responses and public calls for policy changes? I'm going to start with you, though, Ann, because I want you to describe, for those who don't understand what the Aloha Diaper Bank does and has done. And then same question with you, Nikki, right after Anna's Powell, what the Maʻi movement is about. But Ann, please start.
So the Aloha Diaper Bank, we actually supply diapers to our community partner agencies. So what we do is we partner with them. They're already in the homes or educating, different families or helping different families. And what we do is prepare the diapers for them to assist those families. So pretty short and really accurate to making sure that we focus on the family through those partner agencies. We are going to be moving forward, though, however, with helping those individuals that come directly to us. And when they do come to us, we will provide them with diaper need and help them with that, and then get them over to our agencies that can further help them in the future. So basically, in a nutshell, that's what we do, is help those children with diaper need. We have 1 in 3 children that suffer from that need. So we want to seek them out and get them through our partner agencies first, and then get people to know who we are and the kind of help that we can provide. We are in different islands too. So the islands make a difference. Oahu's different than Molokai. Molokai has a way bigger need than Oahu does. So it's very different for us. Even if we're in Hawaii, each island and each neighborhood has such a different need. So it's really, really important for us to work with those partners in those communities that help those families.
Thank you. And Nikki, I would imagine similar story. And I'll ask you both about your grassroots start in both of these efforts. But talk about need. I mean, the Maʻi movement, I think it speaks for itself. It's about women needs. And please share your story, your organization story.
Well, aloha everyone, and mahalo for inviting me to be a panelist today. I'm really excited to share about Maʻi Movement. It's an organization that, excuse me, my sisters and I started, and our mission is to end period poverty. I want to just explain it because a lot of people might be like, what is period poverty? What is menstrual inequity? And that is the inability to access menstrual products like pads or tampons. And it could be due to of course, lack of money, so financial constraints, lack of education, whether that's at home or in school, feelings of societal shame, and also not having access to running water or period-friendly facilities like bathrooms. So we started our organization in direct response to everything that was happening in the pandemic, because periods, they aren't stopping for state budgets, whether you have a job or not. And so we wanted to make sure that, as we saw a lot of communities suffering, needing things from food to housing, and those that are suffering with period poverty are really doing it in silence. So we wanted to, set up our programs. We have monthly care kits with a variety of disposable products. We also have a sustainable kit as well. So to provide access to reusable period products like period underwear, cloth pads, and menstrual cups. But we didn't want to just put products out there. And so we created gender inclusive and locally inspired education. I've had students as young as third grade join, all the way up to 40-year-olds who want to
Wow.
learn more about ways to manage their period or just know, what's happening with their bodies. But of course, with all of this change, we wanted to affect or have real systemic change. And so we also advocate in communities and also in the government so that we can break down, barriers around menstruation. And, for example, last year, we passed the law that made period products free in all K through 12 public and charter schools in our islands.
That's huge. I mean, that is really huge to have that kind of presence in our schools, and really breaking barriers with the DOE or even private schools for that matter, of saying yes, please, we need this. The need is there. I'm going back to you, Anne, real quick, and we have a couple of
Mm,
questions about people who want to help already. But
mm,
how did this? I mean, gosh, every child needs a diaper, but
mm,
not every family, not every mom, not every dad has access to diapers. How did
mhm.
this idea come to you that, hey, we can fill a void here?
It was real quick story. I was on visiting my mom in Las Vegas, and a friend there was a social worker, and she needed to get diapers to a father. It was not a mom, but a father, who was abandoned by the mom and had three young children under the age of 5 that were in diaper need. And she, as a social worker, her hands were tied. She could not be the one to give the diapers. So I said, I can give the diapers. So three of us, I got three of my other friends. We went out, got diapers, and gave it to them. I came home and I thought, man, I wonder what diaper need is like in Hawaii. And I started, just going on the internet and kind of checking around. And I found the National Diaper Bank, which we're part of. Actually, Nikki and I are part of that national membership. But I saw the need, the 1 in 3. And they had statistics of Hawaii. And I thought, who is helping these children? Who are helping these
Wow.
mothers, especially? Because as a grandma now, I that really tugged at my heart. I thought, how can I help these kids? If one small thing is give them a diaper that can change even the demographics or the this of a family. It really was empowering to me how one diaper could make a difference for a mom not having stress, and for a dad not having stress was a really big thing. And then it just started from there. I mean, we have been blessed with a lot of people that want to help, because it is like Nikki said too. Even on the diaper side, it's an unseen thing. Sometimes people don't see it, and moms are ashamed to ask.
Yeah.
And here in Hawaii, we can ask grandma, we can have auntie help, but at a certain point, it's like they're ashamed. I still
Sure.
deal with that today. Still today, we deal with that. Oh, can I ask for a diaper? Of course, you can ask for a diaper. Don't be ashamed to do it, because we're here to help you. So that really, I mean, it's just a small thing. It's a small thing, a small diaper that goes a long way. Yeah.
You said a couple of things in there very powerful. You talked about empowerment, empowering,
Hmm.
and it's consistent theme in all of the shorts that we just saw, the short stories,
Hmm.
empowering people. This is who I am, and it's okay. And then what
Right.
I wrote down a couple of notes. Having to prove you are poor is demoralizing, and it really is that
Right. Right.
stigma.
Right.
Question for Nikki. Question for Nikki. Could Nikki please describe the journey from legislative dismissiveness regarding the provision of menstrual products in our public schools toward one of support? How did that happen? And are we working toward ending period poverty in for all women, as the case is in Scotland?
So I'm going to start with the last question first because I get this a lot.
Hmm.
What is my vision, right? What are we trying to do? And I always tell people, uh, the global goal, right, to end poverty is 2030. And our goal is to not have a job in 5 years, for Maʻi movement to completely dissolve and not have to exist. Because then it would have, we would have achieved our mission to end period poverty and also address menstrual inequity. And that really is, what we're trying to do, very, very similar to Scotland. Um, it's not just about the products, but breaking down, right? All the barriers, the shame, the stigma, And, really just recognizing that this is a basic need, like toilet paper, like soap. Our structures, our buildings, our bathrooms were designed without women and menstruators' needs in mind. And, we've seen structural changes, right? Having changing tables, ramps, so people with different abilities can access public facilities. And so that's kind of the mindset that we are trying to change. Um, and this ties into the legislative journey that we've had, because it certainly was not easy. With the bill, it was a 3-year process. The first year, it was actually introduced by an incredible Ilima intermediate teacher and her student, Miss Millie. Unfortunately, that was in 2020. So that was a COVID year. And, the whole session just ended. Or it was cut short. Now, in the second year, that's when Maʻi movement had, we had started. It was 2 months into our organization when Ledge opened. And we didn't know, right from that, but we said, this is something that we're very passionate about. And so we pushed. But I will say that was a very tough year legislatively, because there were a lot of attention, rightfully so, going to COVID. But we were able to turn our dead bill into a resolution. And it was really interesting because that gave us the opportunity to hear from legislators and the DOE. What were the concerns? And that first year, people struggled. They struggled to address menstruation, to say the word. There were a lot of uh, myths, things that we hear often that can be very infuriating, like, how do we know this is really happening? So having menstruators and students really trying to prove themselves, right, which is not just or fair. So what we did in the interim, we took all that pushback, and instead of getting, angry and frustrated and letting us hold us back, we turned that into a pilot that we ran across 6 schools in the state. And, we provided free period products. We tried to answer all the questions about cost and implementation. And, things that we hear constantly, what if there's vandalism? What if there's hoarding? And for us, it's like, hey, if you need, right? Take. We don't put provisions or, guard our toilet paper or our paper towels. So why would we do it with menstrual products? And what we've always said is that this is a basic need that keeps students from going to school, from, living their everyday lives. And so in that interim, and, with the information from the pilot, it wasn't just about data, understanding cost implementation, but, we did surveys of students and teachers, and we heard their voices. And, I'm really proud to say that that really changed the attitudes of a lot of legislators, of the DOE, and even from the community, right? Because it opened people's eyes to what was happening in our islands. This is not something that's happening on the mainland or the continent or in a developing country. This is our own islands. And so, when we passed the bill, it was with unanimous support.
That's congratulations, because the legislative process can be very, very frustrating, especially from the nonprofit lens and world. Um, but with that in mind, and Nikki, I'll start with you, and we already have a question about that. Is how do you get your message that you need help, and also how can you help? How can they help people? This doesn't happen without funding. I mean, you can't just go
Right.
buy sanitary napkins or tampons or even diapers without funds. So how do you folks what is your needs, and how do you address those needs financially?
For us, it really is a community initiative. It really is, because diapers is a brand new thing. It's like, everybody knows food bank, everybody can relate to that. But for someone to ask for diapers, it's something that's, people have to kind of stop and think about. But it's been a great community initiative doing diaper drives. We have so many different companies, organizations, doing diaper drives for us, and it's a continual diaper drive. So people drop off diapers that they can brand new diapers, or they even drop off diapers that they have left over. So we'll take open packs of diapers, and so it's become a huge initiative. I mean, every every month we have like 4 or 5 diaper drives going on, from Boy Scouts to Girl Scouts to all these different community-based people, which is so great to see. And then other than that, we see a lot of snowbirds that come to visit our islands, want to help, in our community. So in Maui, because we have so many snowbirds there, donating, to how can we be a part of Hawaii? You've given us so much by vacationing here or staying here. And we've seen a lot from outside the islands give us funding, which is really, for us, is really amazing to see. And then other than that, we do go, of course, after different grants that are available. And because it's such a new thing, diapers, a lot of these grants are, wow, we've never heard of that before, and has opened their eyes to it. So
That's good. I mean,
it really is, really
you're opening the conversation. And same, I imagine with you. I wanted to say and because when we think about diapers, we think about our keiki, but we know our kupuna are in
Yes.
diapers too. A lot of
Yes.
them.
So and I will never, turn down a diaper. So we have a lot of kupuna that pass away, and they're looking for us. So they'll call us, and we welcome it. It's not a focus of ours, but we welcome it, and we do give a lot of kupuna diapers out, especially to our outer islands and to our different shelters. So it is welcome. And we do also do kapuna diapers, but we have lots of, like I said, community initiatives that come and help, and they want to be a part of helping. So we're there, and our word is to get it out that we will take in the diapers and help them, relieve them of that too as well.
That's good to hear. And again, people can rally behind a child's needs. Nikki, maybe not so much the drive, or is it community drives that support you folks? Because I'd imagine feminine products are not cheap. I mean, that's one of the reasons why there's poverty, period poverty. How do you folks manage financially to sustain your mission?
The journey has been really interesting. When you think about who menstruates, it's half the population. And, we have seen, incredible movement in the Lahui, right? People who have been there, or people that just empathize and know, what it's like. So they give whatever they can, whether it's, one pack of pads, or if it's, a whole truckload from Costco. So we have been really blessed in that sense. But on the other hand, it has been interesting because, sometimes with grant funding, we still see that institutional shame and stigma around menstruation. I have had funders tell me that, they didn't want to fund my pilot because they didn't understand how, a disposable product could lead to systemic change, or that this is, something that should be taken care of by the individual, that it's a personal issue. And it goes back to, not just period poverty, but menstrual equity, and recognizing, that this is a basic need. So, we started off very, very much, like at the Aloha Diaper Bank, where it's like grassroots funding. I think our first fundraiser was a GoFundMe, because my sister and I started this organization, but we're like, we have no money. So, let's try to do that. And, we tried to do donation drives in the middle of COVID. But eventually, we have kind of gotten to a place where we have, some permanent donation spots that people can go to, and then, regular donations coming from the community. But we've definitely had to be creative and flexible in how we continue to fund our operations.
One of the pieces that we just watched, they talked about solidarity, not charity. And that stigma that comes with having needs and raising your hand, whether it be for food, diapers, female products, that one one diaper, that one feminine product can really change somebody's life. I mean, it sounds dramatic, or even maybe exaggeration, but that's not the case at all. I'm sure you folks have heard stories.
Yes, yeah. One of the things about diapers is it leads to a lot of different things, a lot of different issues that are unseen.
Yeah.
So one of the things is abuse. a lot of times because the lack of a diaper, it leads to trying to potty train your child earlier than that child is ready for.
Right.
So it can lead to that abuse. So a diaper can really relieve that stress, that stress that they have. And we're here to help to educate, to not have that to be ashamed to ask, right? And I think in our community, especially our local community, dealing with so many different cultures, we it's for us not only to give a diaper, but it's for us to say that we want to listen to you, we hear you, and we want to relieve that stress over you, and not make it to where it's here with the handout. We package our diapers in 25s. So when we give it to them, it's not like we're giving them a whole case of diapers. We're saying, okay, this is what we want to give you to help you to relieve that stress so that you still can manage your funds and how we're here to help you. So they can be ongoing with our donations, but we want to relieve the stress. That's a big thing. It's a big thing. So we even help to potty train. So one of our things is to help them to evolve out of the diaper. So we encourage our partners to help to do potty training education, and we'll give them a potty with a little All Pound Now book and some new underwear for their new baby. And if they complete a class, then they get that, and they can move on. And it's all about education. Let's
Mhm.
educate the mom. Let's tell her that we're here. Let's tell her we can help her and see her through the diaper. Yeah.
Interesting. Nikki, same question.
Mhm.
What is the challenges of reaching, I don't want to say client, is it the right word, client? It's, yes, you're in the schools, but how else do you reach out to those in need? How do you recognize, and you obviously don't turn anybody away, but how does that happen?
We definitely don't have any kind of eligibility requirement. When we first started out, we partnered with organizations, but we knew from the beginning not every person goes to an organization, right?
Hmm.
That I mean, now I learned what the term is. It's the Alice population. But growing up, like that was our household. Our mom, I mean, we had family members that were on food stamps. We were not because our mom made more, but it still wasn't enough. We were still paycheck to paycheck. And, a lot of local families were like that even before the pandemic. And so, from the very beginning, as I said, we had a very simple GoFundMe, but we said, we want to make sure that everybody can access or get a Maʻi care kit if they need it. So from the beginning, we had a request form on our website. So they could just enter that how many kits they needed. And our kits have 12 day pads, 5 night pads, 5 tampons, 5 liners, and 5 individually wrapped fem wipes. And the wipes were specific for, anybody that has, they don't have access to running water. So if you think like our houseless population, they still need to keep sanitary and hygienic when they have their Maʻi. So we will mail out directly to anyone, and we have done so statewide as well. So I know it's not a, complete way to reach everyone. I was speaking with some people yesterday, and what really sits with me is how do we get to the hard to reach areas, right? If I think about our rural communities on
Mhm.
Hawaii Island, how do we get there? And so, a lot of it is also word of mouth, working with, people that are boots on the ground and that are in the communities, because there's some relationships where that takes months and years. So, Pilina building is very important in my movement.
Community. It really is.
Mhm.
It really for your efforts and a lot of efforts that make a difference in our communities. I want to just share one thing, and then I want to hear your final thoughts. It's been a fast half hour. Somebody just said, great comment by both of you. Systemic change starts at the lowest level with consistent help, and thank goodness for people like you and organizations like both of you. Final thoughts, and Nikki, I'll begin with you, and Anna, I'll let you finish. But Nikki, your final thoughts.
Oh, this has just been such a wonderful conversation. All the questions that, came in. I know it's People are going to say, how can we help? And one thing I always tell people is it starts with you in your home. How do you treat, menstruation? How do you talk about it? Because from there, that's where we really can make big changes. When we know ourselves, when we are fully educated, that's when we can advocate for harder things. And, what's happening in today's society right now, our bodies, what happens is a constant reminder of the inequity. So how do we go out there and be a good example and be, a person of change?
Basic needs, and diapers one of them.
Uh-huh.
Just your final thoughts.
Basic needs. I thank the community. Really big mahalo to the community, and that's who we need to partner with is our community to help to find those families, the ones that are ashamed to come out because we started right before COVID, and at that time it opened my eyes when we started 3 years ago. I could have no prejudice to anybody, any family, because we never know where our families are in that in a stressful time. So any family, anybody out there that needs us, we need the community to help us to find those people, to drive them to us. So we really, really, it is, Aloha Diaper Bank is a community-based organization. We started as volunteers. We got so many volunteers. And if you'd like to come and help us, we would volunteer. Right now, as I speak, we've got pallets being delivered. I'm like, I need a whole bunch of guys to come help to deliver, unload it. But I big mahalo to everybody in the community that can reach out, look for families, and send them to us. That would be a real good blessing.
Thank you.
Thank you.
And you're real quick, your website folks can visit, and we'll put it on the
Mhm.
screen and in our information as well.
So alohadiaperbank.org, and of course we're on the different social media platforms. You can find us.
And Nikki?
MaʻiMovement.org, and our social media is at Maʻi Movement Hawaii.
Ladies, thank you very much. Nikki-Ann, thank you for
Thank
spending
you.
your afternoon with us. But
Mhm.
more importantly, thank you for making a difference in our community with your efforts. Things that we think are so basic and so sometimes take for granted are right there in front of us, and the needs are great. Thank you very much.
Thank
And
you.
this concludes our panel discussion this afternoon, and we want to thank you for all spending the afternoon with us. And again, sorry we didn't get to all of the questions. Great questions today, and I knew they'd come pouring in. And again, thank you very much for your questions. Just a heads up, PBS Hawaiʻi will be sending out a survey for all of you to fill in and fill out for us about today's event. Please take some time to fill that in because we want to get better at this, and we want to continue to provide these opportunities for discussion and feedback. Your feedback and your comments mean a lot to us. Also, that's a QR code on your screen. Please consider providing a gift for PBS Hawaiʻi. Again, we too rely on the community's support
Mhm.
for all that we do here, the content that we develop and deliver to all of you. To donate, just simply scan that code on your screen, and it'll take you right to our donation page. Again, thank you very much for being a part of us and this different effort of short films. It's not one of those long movies or films that we usually do, but again, the panel discussion is where it's at. And again, I want to thank Ann and Nikki for spending some time with us. On behalf of myself and all of us here at PBS Hawaii, until next time, ahui.